Greetings and welcome to the special edition webinar wherein APTA staff will be providing an overview of the calendar year 2021 physician fee schedule proposed rule and our advocacy efforts fighting against the 9% cut. I'm Kara Gaynor, APTA's Director of Regulatory Affairs, and I'm joined today by my colleagues.
Hi, I'm Laura Keeble. I'm Grassroots and Political Affairs Specialist.
And hi, I'm Justin Elliott, Vice President of Government Affairs at APTA.
Thank you for taking the time to attend today's webinar. And should you have any questions, please do not hesitate to contact APTA at advocacy@apta.org. Today, we will be reviewing CMS's 2021 Physician Fee Schedule Proposed Rule Policies Impacting Physical Therapy, confirming regulatory and congressional opportunities to stop the 9% cut, and review APTA's press, social media, and grassroots activities. I'm going to start us off by reviewing several of the proposals included within the fee schedule rule, specifically telehealth, MIPS, and then the 9% cut. Regarding telehealth, CMS is proposing to permanently allow PTs to furnish and bill e-visits, virtual check-ins, and remote assessment of recorded video and/or images submitted by an established patient. However, CMS does not have the statutory authority to extend permanently PTs as eligible telehealth providers beyond the expiration of the public health emergency. Thus, we need Congress to pass legislation that specifically adds PTs as telehealth providers under Medicare, which continues to be a priority for the association. Now that said, CMS is seeking comment in the rule regarding adding other CPT codes to the list of covered telehealth services and describing them under a new category termed Category 3. This new category would describe services that are included in the Medicare telehealth services list on a temporary basis through the calendar year in which the public health emergency ends. CMS would include in this category the services that were added during the public health emergency for which there is likely a clinical benefit when furnished via telehealth, but for which there is not yet sufficient evidence available to consider the services as permanent additions under Category 1 or Category 2 criteria. Now, while CMS has not proposed to add PT codes to the list, APTA will be providing CMS with compelling arguments regarding why CMS should recognize that there is clinical benefit associated with physical therapy services furnished via telehealth, and that such codes should be added on a temporary basis and eventually permanent basis in anticipation of PTs being recognized as eligible to furnish and bill telehealth through future legislation. Now, in regards to the MIPS program, overall, CMS isn't making drastic changes to MIPS, but there are a few proposals of note. CMS is proposing a performance threshold of 50 rather than the previously finalized 60 points for the 2021 performance period. And the performance threshold reflects the number of points needed to avoid any penalties. CMS is proposing to add 2 process measures to the PT/OT specialty set and is proposing to remove measure number 282 because they feel the measure is duplicative of the functional outcome assessment measure number 182. Now for measure 226, which is preventative care and screening, tobacco use, screening and cessation intervention, CMS is updating the denominator for all collection types to add MIPS eligible physical therapy clinicians and telehealth as eligible encounters for all submission criteria. CMS is continuing to reweight the promoting interoperability and cost categories for PTs in 2021. And CMS proposes to delay the shift to the more streamlined version of MIPS, which CMS has dubbed MIPS Value Pathways, or MVPs, until 2022 or later. They've also proposed additions to the framework's guiding principles and development criteria to support stakeholder engagement in co-developing MIPS Value Pathways and establishing a clear path for MVP candidates to be recommended through future rulemaking. Now, as illustrated in the proposed rule in Table 90, CMS is estimating that the combined impact of the reduction slated for physical therapy, occupational therapy, and speech language pathology services in 2021 is -9%. And that reduction is being implemented through the application of the budget neutrality adjustment to the conversion factor to satisfy the budget neutrality requirements set out in the Social Security Act. It's important to keep in mind that the actual impact to each individual provider will vary based on billing and practice patterns, and the 9% estimate, which is a combined impact across the three therapies, is not necessarily applicable to each provider. Let me explain a little bit further on the next slide. So Medicare uses the fee schedule to determine payments for approximately 10,000 different services, and the fee for each service depends on its relative value units, or RVUs. And RVUs define the value of a service or procedure. So to determine the payment amount under Medicare, a service's RVUs are multiplied by a dollar conversion factor. So the estimated 9% cut to payment is a result of CMS adjusting the conversion factor downward for 2021. So the calendar year 2021 physician fee schedule conversion factor is estimated to be $32.2605, which is a decrease of $3.83 from the current conversion factor in 2020 of $36.0896. Now, on this next slide, these are the proposed RVUs for some of the codes used by PTs as compared to 2020. And as you can see highlighted in yellow, many of the codes would see small increases in value, some of them more significant, such as the eval and re-eval codes, and to a smaller extent, the orthotic and prosthetic management codes. Now, CMS is proposing significant increases to the evaluation and re-evaluation codes because CMS identified them as analogous to the office outpatient E&M services, in that they believe that a significant portion of the overall work in the eval and re-eval codes is for the assessment and management of patients, as it is for the office outpatient E&M visit codes. CMS felt it important to revalue the eval and re-eval codes to reflect the overall increase in value associated with spending time assessing and managing patients, as reflected in the changes to the work values for the office outpatient E&M visits. Now, despite these individual increases to code values, the drastic reduction in the conversion factor, which, as I said a moment ago, is used to calculate the payment amount for each code, is what has led CMS to estimate the 9% combined impact in reduction in payment across the three therapies. But again, I do want to emphasize that the actual impact to each provider will vary based on billing and practice patterns. And before I move on, I do also want to clarify that this is not CMS trying to penalize the physical therapy profession. Because CMS has to maintain budget neutrality under the fee schedule, and because they are proposing significant increases to some of the E&M codes that are billed, those increases have to be offset by decreases to other codes, and therein maintaining budget neutrality. And CMS does that in terms of maintaining budget neutrality by reducing the conversion factor in this instance, which is why if CMS is proposing significant increases in 2021 to some codes, that requires obviously a significant adjustment to maintain budget neutrality, you're seeing that drop in the conversion factor of almost $4 because the increases are not in this year, they're in 2021. And so it's maintaining that balance, which is where those payment reductions come into play. And as Justin will talk about later, there are a total of 36 specialties facing payment reductions, not just PT. So on the next slide, I want to emphasize that it's important that your voice is heard. APTA is strongly opposed to the 9% payment cut and will be submitting 2 sets of comments to CMS prior to the comment deadline of October 5th, 2020. And 1 letter will be specifically responding to the 9% cut, and we plan to submit that as soon as possible. But in addition to APTA submitting comments, we also need every PT, PTA, student, and patients to lend a voice to this effort and tell CMS that they must halt implementation of the payment reduction to physical therapy. There will be thousands of comments submitted in response to this rule before the deadline, and we want to ensure that the physical therapy profession's voice is louder and stronger than all the rest. With our voice, we need to overwhelmingly demonstrate to the agency that the physical therapy profession does not stand for arbitrary, penalizing policies that will only serve to harm patients and providers in the short and long term. So how do you submit comments to CMS? Well, let me take a minute to explain the process. APTA is offering publicly available, customizable template letters for all PTs, PTAs, students, and patients to use to send comments to CMS. And we encourage clinicians to specifically incorporate into their letter personal examples regarding how those cuts will impact them and their patients. So please feel free to go to our Regulatory Action Center and download our Word document templates and provide them to your employees, peers, colleagues, patients, family members who are on Medicare. Everyone is eligible to submit comments. But also keep in mind that submitting comments to CMS should be done in addition to contacting your members of Congress, which Laura and Justin will talk about in a few minutes. And submitting comments to CMS is a different submission mechanism and a different process from writing to your member of Congress. So after you visit our Regulatory Action Center and you download your applicable template letter and you customize it, and you make sure to delete the submission instructions at the top of the letter, you will follow the link that we provide as demonstrated on the slide that's found on the Regulatory Action Center, where it says take action, submit comments. And again, this is the submit comments link is next to the downloadable Word document templates. So for PTs, PTAs, and students, when you get to the comment submission page, copy and paste your introductory paragraph from the comment letter into the comment box that you'll see, and then upload your entire comment letter as an attachment. And then you'll want to answer or provide information to their other questions. Basically, they ask for your name, and you can provide your contact information. Patients have a shorter letter than the template letter provided for PTs, PTAs, and students. So patients will just copy and paste their comment letter into the comment box, and they don't need to upload their letter as an attachment. And then they would follow the same process of providing their name and contact information if they so choose. And then you go ahead and submit. It's that easy. So please take advantage of this opportunity, submit comments early. This is an opportunity for the physical therapy profession's voice to be heard, and we need to ensure that every voice is heard loud and clear, that we all are telling CMS, stop the cut, do not implement this cut on January 1st, 2021. So with that, I'll now turn it over to Justin Elliott, who will review our efforts underway with Congress.
All right. Well, thanks, Kara. And we can go to the next slide. So ever since last summer, when the proposed Medicare 2020 rule came out and CMS gave indication that they were moving forward with this proposal, APTA and a number of our partners have been engaging on Capitol Hill, warning them about this proposal and the potential implications that it would have on patient access, small business, and the healthcare system in general. Now, Congress to date was hesitant to move forward with any type of legislation to intervene with this proposal. Many Hill offices wanted to wait and see if CMS was serious about this proposal and wanted to see when if it was going to be included in the proposed 2021 Medicare physician fee schedule. Well, as we all saw earlier this month, CMS proposed their rule and they are moving forward with this proposal and with these steep cuts to over 35 different healthcare provider groups. So now it's time for Congress to act. They have to intervene. Now, as Kara mentioned, CMS is somewhat constrained by what is known as budget neutrality. This is a requirement that under the Medicare physician fee schedule, if CMS makes increases to some parts of the fee schedule or to certain codes, they have to make cuts elsewhere in the fee schedule so that it balances out. And so that is why you see increases, the increases for primary care are being subsidized by cuts to over 35 different healthcare provider groups: PT, OT, orthopedic surgeons, radiologists, and pathologists. Now, we don't oppose increases to primary care. We have no beef with that. But what they're proposing is a robbing Peter to pay Paul policy solution. And again, this is not good for patient access, not good for small business, not good for the healthcare system, particularly in the middle of a global pandemic. It's just not good public policy. Now, there is a way for CMS and for Congress, particularly, to fix this. CMS does not have the legal authority to do what's known as waiving budget neutrality. So that way they don't have to do that balancing out. Congress needs to act. They need to intervene and pass legislation which would provide a waiver of the budget neutrality. That would allow for the increases to go into effect on January 1st for the E&M codes and would not require the cuts to 35 different healthcare providers, including PT. Now, for that to happen, though, Congress must infuse more money into the fee schedule to help pay for those increases. And that's going to require an act of Congress. Let's go to the next slide. So ever since last fall, when the proposed 2020 rule came out, APTA has reached out to all of the different provider groups who are impacted. And what you see on the screen are just a handful of some of the groups that APTA has been working with a whole host of not only non-physician provider groups like our partners at AOTA and ASHA and the Academy of Audiologists, but also coordinating and working with the American Medical Association, American College of Surgeons, the radiologists, the pathologists. And we've come up with this informal fee schedule coalition. And we have been working both individually and collectively to get this message to Capitol Hill ever since last fall when we saw that CMS was thinking about doing this proposal. We've been doing meetings with Capitol Hill offices. We've done a number of coalition letters to Capitol Hill. We've engaged in political events with members of Congress. And some of you may be aware of just some of the activity that's happened since last fall. There was a letter that was a House sign-on letter where 55 members, bipartisan members of the U.S. House last September sent a letter to CMS expressing concern that what this proposal and its impact on physical therapy, occupational therapy, and speech language, what that would do, particularly in rural and underserved areas. That was followed up by another letter from the U.S. House of Representatives signed by 99 bipartisan members of the U.S. House, again, to Seema Verma, questioning the methodology of this proposal. How did she come up with these cuts? Why did she target these providers and not others? Again, questioning what is the math behind this proposal for the E&M codes. And then in May, Congressman Bobby Rush, a Democrat from Illinois, and Republican Susan Brooks did another bipartisan letter signed by 46 members of the U.S. House of Representatives saying that Congress must intervene. And this letter was sent to the House leadership, Speaker Pelosi and Leader McCarthy, basically saying it's time for the House to act and do something in one of the COVID relief packages that would intervene and prevent these cuts from occurring. So there's been a lot of activity raising this awareness with Capitol Hill over the past year. But now that the proposed 2021 fee schedule is out, it is time for Congress to act, because at this point, that's the only way to prevent these cuts from occurring unless CMS decides not to implement, which again is not going to be happening. Seema Verma and CMS seems pretty intent on moving forward with this proposal. We can go to the next slide. So APTA, our goal is to increase payment for physical therapy services to help reflect the value that physical therapy adds to the healthcare system, to Medicare beneficiaries. Now, what's ironic is that, as Kara mentioned, in the fee schedule, there's increases for PT evals and re-evals, and that boosts our payment. And unfortunately, those increases are gutted by this E&M code proposal. And so we want to not only prevent those cuts from going forward, because they would be devastating to PT, to patient access, to the healthcare system, but if we're able to stop those cuts from going forward, we will see and benefit from those increases in the evaluation codes. And so what is Congress looking at? How can they intervene? Let's look at what some of the proposals that are currently being discussed. Let's go to the next slide. So first, what we want is a permanent fix. We want Congress to intervene and provide a permanent fix to this whole proposal. And basically what that would require is for them to do a complete waiver of budget neutrality, which is Congress scores proposals on a 10-year window. So this would basically be a waiving of the budget neutrality for the proposal, and they would score it over 10 years. That would though require Congress to put in $75 billion in new money specifically for the Medicare physician fee schedule. So one option to do this, and there's a bill that's already been introduced in the U.S. House. It's H.R. 7154, introduced by Congressman Boyle and Buchanan, again, a bipartisan bill. This bill was introduced earlier this summer and is known as the Outpatient Therapy Modernization and Stabilization Act. It's a good bill. It has a lot of issues in it that directly impact therapy. But if you look at the bill and you look at Section 2 of H.R. 7154, you will see this language in it. This specific language in it is language that would waive the budget neutrality requirement for the entire E&M code proposal. And so again, this is a high watermark. This is our message to Congress that if you want a permanent fix, what is the perfect policy to resolve this? It's Section 2 in H.R. 7154. Now, the downside is that it's $75 billion, which is a good deal of money. So let's go to what some of the other options that Congress could consider doing. Let's go to the next slide. Well, some folks, you all may have heard back on August 11th, Congressman Bobby Rush led another sign-on letter. And this time, this letter went to Speaker Pelosi and Leader McCarthy. This letter was signed by 92 bipartisan members of the U.S. House, Democrats and Republicans, coming together to say that it's time for the House to act. Specifically, their proposal would put a 2-year pause just on the cuts. The increases would be allowed to go forward, but there would not be the cuts to 36 different provider groups. And so this two-year pause on the cuts has a price tag a little bit less than $75 billion. This would be about $11.5 billion. And it would also ask CMS to report back to Congress during that 2-year pause window, what would be the impact of these cuts, particularly on rural and underserved areas. And it would give more breathing room for Congress and CMS and impacted parties to come together to come to a better solution than just doing broad cuts to 36 different provider groups. So we are grateful to Congressman Bobby Rush and to the 92 bipartisan members who, again, raised this issue with the House leadership. Their ask was for this to be included in the upcoming COVID Phase 4 relief package or any other legislative vehicle that will be moving between now and December 31st. So this is a second option that is currently being floated. Let's go to the next slide. A third option, which is still in the works, Congressman Barra and Congressman Bouchon, again, a Democrat and a Republican, have expressed commitment to finding a solution to this, providing some sort of resolution through legislative action. And they are currently looking at potential policy options, working with the House Ways and Means Committee staff. And this is going to be one of the critical committees on this issue, the House Ways and Means Committee. Also, what's going to be another critical committee is the Senate Finance Committee, because these are the two committees that are going to need to find money to infuse into the Medicare fee schedule. So right now there are discussions underway. What this proposal may look like, we don't know yet. It could be a 2-year. It could be the 2-year freeze that Congressman Rush and the 92 members of the House have been advocating for early in the August 11th letter. It could be maybe something longer. It could be something completely different. And again, this would provide something, again, a pause to these cuts so that there could be a broader discussion about not only this policy, but it's time to maybe look at the fee schedule in general, because as we all know that there are a number of issues and concerns with the Medicare fee schedule. Now, in terms of when this bill may or may not be introduced, it's very much in the air. Again, conversations are happening right now as we speak up on Capitol Hill. And so I would expect that if this bill was to be dropped, it won't happen until after Labor Day. And let's go to the next slide. But what's important, and this is critical, and that is the timeline for Congress to act. We have less than 5 months before this policy gets implemented, and there are a number of challenges that we have to face. First, it's August recess. Congress is out of town right now. They are still trying to work on a COVID Phase 4 legislative package. That was supposed to have been done weeks ago, but they are still, negotiations as of right now are at an impasse as to the size and scope and money that will be included in a COVID Phase 4 relief package. Now, as we mentioned, there is a proposal from the 92 members of the House that would ask that for a 2-year pause on this with a report from CMS to Congress for inclusion in the COVID Phase 4 package. So we'll see if that comes together. But now when Congress comes back in, after Labor Day in September, there are a couple vehicles, legislative vehicles, we could see a legislative proposal to address the E&M code that it could be attached to. There's a giant surface transportation vehicle that Congress has to pass in September. We're going to look at maybe hooking something onto that. There are a number of what are known as continuing resolutions, CRs. These are bills that Congress has to pass to keep the government open. And so looking at maybe one of those vehicles to try to hook a solution onto. Of course, you know, we have the election that's going to be heating up later this fall. It's already heating up right now. And so that will be a major distraction for Congress. But when they come back after the election, they have what's known as the lame duck session. And there are a number of healthcare extenders that they have to pass. These are programs that are running out of money, things like National Health Service Corps, community health centers, number of vital programs that have to be extended by Congress or they are running out of money. And so those are, again, going to be potential major legislative vehicles that we will be looking at trying to hook a solution to the E&M code proposal too. So again, we have a short amount of time. We have a very challenging schedule, and we have a lot of political variables that are outside of our control. But we need to keep the pressure up in terms of getting this message to Congress that they must act, and they must act before the end of this year, or else over 35 different healthcare providers are going to be significantly cut. Let's go to the next slide. So, you know, along with amplifying our message to CMS, as Kara pointed out, and amplifying our message with Hill offices, we are working to continue to carry that message via press, social media, and our grassroots. Let's go to the next slide. Just over the past week and a half, here is just some of the media hits that we've been doing to amplify this message to the public. For example, in the lower right, you see the article about providers to look to Congress to avert physician pay cuts. That was a story that appeared in Inside Health Policy about the proposal signed by 92 House members to put a 2-year pause on the cuts. And that is, Inside Health Policy is a publication that's read by pretty much every Capitol Hill office and is very influential. You see the joint statement that was put out by AOTA, ASHA, and APTA. And of course, you see the press release that says Congress must act to prevent further damaging cuts to the healthcare system, which was a press release that, again, the coalition put together, signed by a number of different healthcare organizations, including APTA, AOTA, and ASHA. Let's go to the next slide. And of course, we are working to push our message out via social media. Here are just some of the social media graphics that we've pushed out just over the last week. I invite folks who are listening to share these. If you're on Twitter, Instagram, Facebook, again, please feel free to utilize these graphics to help spread the word. Our hashtag on Twitter is #FightTheCut. Again, our goal is to amplify and make as much noise over the next several weeks and next several months until a solution is enacted by Congress. And of course, a key element to that is our grassroots advocacy and engaging both members, non-members, and patients. And for that, I'm now going to turn it over to APTA's leader for our grassroots program, Laura Keeble. Laura?
Great, thank you, Justin. So again, my name is Laura Keeble, and I'm the Grassroots and Political Affairs Specialist for APTA. I work to build and strengthen our grassroots programs and help to give the physical therapy profession a constituent voice on Capitol Hill. With this push around the 9% cut, we've had many tools at our disposal for both APTA members and non-members, including patients and colleagues, to let their voices be heard by Congress. We've even had APTA members, friends, and family send letters. Our member-exclusive Legislative Action Center and our public Patient Action Center have had over 30,000 letters go to Congress after the action alert was released on Wednesday, August 5th, which is an incredible amount of letters. These template letters from our action centers also provide the opportunity to advocate to add in their personal story, further highlighting and driving home the need for Congress to take action. As Kara mentioned before, we are also pushing for PTs, PTAs, patients, etc., to submit their comments to CMS and providing with the information, instructions, and a template in order to successfully do so. Additionally, APTA key contacts and federal affairs liaisons, or FALs, our grass tops groups, helped to secure signatures on the Congressman Rush letter last week. With the tight turnaround, the invaluable relationships these APTA advocates, along with assistance from our partners, helped to obtain those signatures for this super important letter. In September, we are also hosting a virtual rally the first week after Labor Day to further raise awareness and ask for Congress's intervention on this issue. Though we are specifically looking to prioritize efforts directed at Republicans on the Senate Finance Committee, we are encouraging everyone to take part, share their stories, and raise their voices. We are also looking at deploying action alerts, a social media blitz, testimonial photos and videos, and more to be determined. And next slide, please. So the timing of this advocacy work really couldn't be better because APTA key contacts and federal affairs liaisons are currently meeting virtually with their members of Congress for August recess. In a pre-COVID world, our key contacts and FALs would be hitting the pavement and meeting in person with their legislators, going to town halls and fundraisers in person, and hosting legislators at their practices in schools. Though the COVID-19 crisis has largely ended in-person meetings, that hasn't stopped or deterred our advocates. They have risen to the challenge, and so far we've had nearly 20 virtual visits, Zoom town halls, Facebook town halls, teletown halls, and counting. Coming up in the next few weeks, we also have virtual practice and school visits, and I will say yes, that is possible if you have a smartphone and some planning and assistance, and of course PPE for these. We also have virtual fundraisers and more face-to-face virtual visits with members of Congress and their staff by our key contacts and FALs. Our preparation of our advocates is also very deliberate. We've offered prep calls to our key contacts to make sure they are comfortable with the meeting and the asks. And that is also in tandem with a written guide with step-by-step instructions on how to schedule an August recess virtual meeting, as well as helpful tips, tricks, and talking points. With our focus on advocate training and professionalizing our advocate core, we also hosted a Q&A recorded webinar at the end of July to further prep our grassroots. Our members are well equipped to raise their voices, and with all of these efforts together, we are leveraging every means necessary to fight the 9% cut. And we're excited to see the results this August, and we look forward to continue doing everything in our power to fight the cut. So thank you very much for your support, and I'll turn it back over to Justin.
All right, thanks, Laura. Now on the screen, you can see a number of internet links to some of the resources that we have put together to help assist both members and patients and non-members on this proposal from CMS. Of course, APTA staff, if you have questions, we're always a resource, so you can always email us at advocacy@apta.org. Our goal over the next several weeks and months is to raise as much noise with CMS and with Capitol Hill on this issue, on this proposal. The idea that CMS is moving forward with devastating cuts to over 35 different healthcare providers is unconscionable during a global pandemic. This proposal will not only impact providers, a wide range of providers, from PTs and OTs to radiologists to surgeons to audiologists, but it's also going to impact patient access in rural and underserved areas. So we are rallying, we're going to fight this cut, and we are going to make a difference. And with your help, we'll get it done. Thank you for joining us today, and thank you for being members of APTA.